Okay, so welcome to another episode of EDTalks. Today, I want to talk about something a little different than pain management and anesthesia. There was an interesting article on Yahoo about a clash amongst physicians in regards to euthanasia for the mentally ill. So first, a little bit of background. Physician-assisted suicide does exist in the United States. I think it exists in about 6 states, and it is for terminal conditions such as terminal cancer. Euthanasia for terminal conditions does exist in certain other countries. And again, for conditions such as terminal cancer. Euthanasia for psychological suffering is allowed in about 2 countries, I believe. And that information came from the article, which I'll be posting as a link on this site. So they're talking about patients who are on multiple psychiatric medications, who decide that life is just not worth living, that they cannot function, and hence ask for euthanasia because they feel that their condition is terminal and don't want to continue living that way. The thing is that there's a dramatic difference in my mind between psychological suffering and a terminal cancer. Granted, terminal cancer may at some point in the future be curable. I remember growing up and being told that every 5 years, I was always being told that in 5 years, the cure for cancer was going to come. It was like every 5 years, in 5 years, the cure for cancer is going to come. And certainly we've made strides, but we haven't actually cured it yet, per se. So, will we cure cancer? Sure, but not for the foreseeable future. Psychological suffering is a little different. We make strides in psychology literally every day. For example, we now know that hearing voices might not be such a bad thing, and that we don't necessarily need to medicate patients for hearing voices. 5, 10, 15 years ago, we told those patients that they needed tons of psychiatric help and psychiatric medication, and basically had them believe that they could not lead normal, fulfilling, happy lives. But as we continue to allow people to be who they are and to function as they function, and as society embraces the differences that we all have, whether they be physical or psychological, a lot of these diseases and conditions that we thought we needed to treat, we no longer need to treat. And not only that, we allow the person who's experiencing these things to feel like they belong in society again. So a person who feels a lot of intuitions and things no longer feels like they're an outcast, or no longer need to feel like they're an outcast. And when these people feel like they belong, their need to seek something out like euthanasia for their psychological issues might begin to lessen. So I think this idea of euthanasia for psychological suffering is a bit premature because society, and it's very difficult to break apart society and psychology and the human experience and truly delineate any of that as medical. So I think that we are making strides in psychiatry and psychology, and I think that the idea of euthanasia for severe psychiatric conditions is a little premature. Let's not forget history, folks. Eugenics started with people saying that the mentally ill needed to be removed from society. And the United States was one of the first countries to really move forward with this. And actually, Nazi Germany got a lot of their data and information from the United States. They simply executed a lot faster and on a larger scale. But all that eugenics came from America. So we have to remember history, and we have to remember where we are, and we have to remember our limitations before we jump into something as dramatic as euthanasia. Anyways, that's my thoughts. Not sure they're that good, but shared them anyways. Maybe I shouldn't have, but I did. We'll see what happens.